Did you know that Medicare covers a surprising number of health services completely free of charge? That's right, no copay, no deductible, and no out-of-pocket costs. In today's video, we're breaking down what Medicare gives you for free so that you don't miss out. I know a lot of people assume that Medicare is expensive with premiums, deductibles, and copays that are always adding up. And yeah, some parts of Medicare do come with costs. But there are also many services that you can get for absolutely nothing. The trick is knowing what's free, who qualifies, and how to make sure that you don't accidentally get charged. Because trust me, the rules can be so confusing. That's why I'm super grateful for our expert Medicare partners at Chapter. Their team understands all the ins and outs of Medicare, and they can help you make the most of the benefits that are available to you. Best of all, their guidance is completely free. So if you ever have questions about Medicare, don't hesitate to reach out. You can contact them using the number or link that you see on screen. The first freebie we're going to talk about is your Welcome to Medicare visit. This is the first freebie you get, and you have to use it within 12 months from the time that you first enroll in Part B. So don't wait too long. This visit is a health check to set a baseline for your future care. Your doctor will go over your medical history and the medications you're taking. They'll check your blood pressure, height, and weight just to get a sense of where you're at right now. You might do a simple vision test, and your provider will ask some questions about your mental and behavioral health. On top of that, you might get access to important vaccines or other health services, but you need to make sure that you ask in advance what's included in the free Welcome to Medicare visit and what's not, so that you understand what's what and you don't get charged for any surprise services. After your first year on Medicare, you qualify for a free annual wellness visit every year. Now, I want to be really clear about what this is and what this isn't. It is not a full physical exam. A lot of people expect a head-to-toe checkup, but that's not what this visit is for. Instead, it's a chance to check in with your doctor, review your health history, and create or update your personalized prevention plan to help you stay healthy. During this visit, your doctor will check your vitals, talk about any changes in your health, and assess your risk for certain conditions. They'll also do a cognitive assessment to check for early signs of dementia, which is so important because early detection can make a big difference in your treatment. Just like the Welcome to Medicare visit, this is completely free. But if your doctor orders additional tests like lab work or blood tests, you could have out-of-pocket costs. So it's always smart to ask before agreeing to anything extra. Now let's talk about vaccines, because this is another area where Medicare covers a lot for free. Thanks to a recent law change, most Medicare-covered vaccines are now completely free. No copay, no deductible, no surprise bills later. That includes the shingles vaccine, which used to be really expensive, but is now free if you have Medicare Part D or a Medicare Advantage plan that includes drug coverage. And if you're at high risk for hepatitis B, that vaccine is covered as well. Whether you're on original Medicare or a Medicare Advantage plan, these vaccines are supposed to be free to you. But if you're on an Advantage plan, you're going to want to make sure that you go to an in-network provider so that you don't get hit with an unexpected bill. Now, preventative care is another area where Medicare covers a lot at no cost. This includes screenings for cancer, diabetes, and mental health. If you're 45 or older, you're eligible for a free colorectal cancer screening. This includes stool tests, sigmoidoscopies, and colonoscopies at certain intervals. If you're a woman aged 40 or over, Medicare covers a free mammogram every year. If you're a man over 50, you qualify for free prostate cancer screenings. These are incredibly important because early detection saves lives, and with Medicare, you don't even have to pay to get screened. Medicare also covers one free depression screening per year. This takes place at your doctor's office and helps assess your mental health, which is especially important for older adults, since depression and isolation can become more common as we age. If the screening finds that you need follow-up care, that part might come with a cost, but the screening itself is free. Now, if you're at risk for diabetes, Medicare will cover up to 2 free diabetes screenings per year. Your doctor will determine if you qualify based on factors like high blood pressure, high cholesterol, or family history. And if you already have diabetes or kidney disease, you can get free medical nutrition therapy. This includes a personalized nutrition plan, meal planning support, and follow-up visits with a specialist to help you manage your condition. For people with a history of smoking, Medicare covers a free lung cancer screening once per year if you're between the ages of 50 and 77 and either smoke now or quit smoking in the last 15 years. And if you're trying to quit smoking, Medicare will cover up to 8 free counseling sessions per year to help you quit for good. It even covers alcohol counseling. So if your doctor thinks that you're at risk for alcohol misuse, you may be able to get up to 4 free face-to-face counseling sessions every year as well. Now, if you're on a Medicare Advantage plan, all of these services may be still free for you, but there is one big difference you need to be aware of. You have to go to an in-network provider to get them fully covered. If you see an out-of-network doctor, your plan might charge you, so always check before you book an appointment. So how do you make sure that you're getting all of these free benefits? First, always ask if a service is fully covered before your appointment. Second, make sure your doctor accepts your Medicare or is in network if you're on an Advantage plan. And finally, don't assume that just because something is labeled preventative, that it's automatically free. Follow-up tests or treatments or other things may come with a cost, so always ask questions first. Medicare can give you a lot for free, but only if you know how to take advantage of it. So let me know in the comments, have you ever used any of these free benefits? If not, which one do you plan on using first? And if you found this video helpful, be sure to subscribe for more ways to save money on healthcare, food, and other essentials.